and Wanda Williams. Thank you both, ladies, for being here. I want to thank President Biden. President Biden has a whole-of-government approach to this pandemic, using every single tool at our disposal to make sure as many residents as possible are able to get this vaccine through stores like Publix, Winn-Dixie, Walmart, Walgreens, CVS, and more. Every story of a Floridian receiving one of these life-saving vaccines is a true victory, especially our most vulnerable Floridians, our seniors. And to anyone over 65 who's hearing me today, I want to encourage you to register to receive a COVID-19 vaccine at patientportalfl.com or by calling 844-770-8548. I also want to reassure you that this vaccine is safe, it is effective, and thoroughly tested, and thoroughly researched. And you don't have to take that from me, you can take it from thousands of healthcare professionals. But if my voice counts for anything, let me also say that I've been vaccinated, and I feel great, and I feel very healthy, and I feel very blessed. But unfortunately, the story of Florida's vaccine distribution has not been one of fairness. We need to discuss what has become the civil rights issue of our time. Equal, equitable access to this vaccine is demanded, and it's only fair and right to do so. Last week, I called for a Department of Justice investigation into Governor DeSantis' pop-up COVID-19 vaccination sites, created at the request of wealthy donors for wealthy communities like Lakewood Ranch, the Villages, Sarasota, allowing his donors and allies to skip the waiting line everyone else has to navigate. The Department of Justice needs to look into it. The Manatee County Sheriff's Office is already investigating this situation. Directing vaccines toward the politically connected and away from the millions of Floridians who have been waiting in line for months for this life-saving vaccine is just plain wrong. And this is happening as a result of what the governor admitted himself last week, which is he doesn't have a plan for getting vaccines to the people of Florida. He's making it up as he goes along, and we suffer as a result of that. That lack of preparation and leadership has been pretty obvious since the very beginning, as our state's millions of seniors have been forced to navigate crashing websites, busy phone lines, and conflicting information just to get a chance to have a vaccine appointment. This process has been especially difficult for our seniors of color, who often have less access to high-speed internet necessary to win this high-stakes lottery. Per the state's own data, Black Floridians make up about 17% of our state's population, and about the same percentage of coronavirus deaths, but have received only 5% of the vaccines. The reality is even more stark for the Hispanic community, where Hispanic Floridians make up 26% of our state's population and COVID-19 deaths, but have received only 8% of the vaccines. This data is truly devastating. It is indicative of a deep systemic failure to serve and protect our fellow Floridians, and no matter what top decision makers like Governor DeSantis make about getting vaccines to all regardless of political affiliation, these numbers and the lives and people they represent speak volumes. Even decisions like directing vaccines to stores like Publix ignore the reality that in many communities of color, these retailers simply are not there, including right here in South St. Petersburg. And lack of statewide investment in public transportation make the miles-long journey to reach them almost impossible. For residents of these food deserts, especially our homebound seniors. Having worked along faith leaders like Reverend Irby, Pastor Haynes, and others, I can tell you that there's no one better to get these vaccines to members of our community. So I am calling upon our governor to open his heart and prioritize people over politics to get these vaccines to communities that have been hit the hardest by this crisis. People ask me, Charlie, you've been governor. What would you have done differently? 3 things. Number 1, I would have had a plan. No plan is perfect. Plans do change, but without them, decisions aren't as well informed, and in this case, people have certainly passed away. We knew the vaccine was coming. There was no excuse to not be ready. Number 2, I would have prioritized the vulnerable from the very start. That's not only our seniors, but the highest risk seniors. Not only nursing homes, but communities that were the hardest hit. And many of them were Black, Hispanic, and Native American. And third, I would have been transparent. Governor DeSantis' administration is the least transparent in my lifetime, and that's saying a lot. The best disinfectant is sunshine. And for some reason, he doesn't want to let the light in. You can draw your own conclusions on that point. Having no plans means you don't have to be transparent because there's nothing to share. It's a feature in the way this administration has operated. Number 1, you need a plan. Every Floridian who has lived through a hurricane season knows that you need to have a plan. We have all known vaccines were coming. You've got to be prepared. You've got to have a plan. The governor still has no comprehensive strategy, and it shows. And the people suffer as a result of it. The website didn't work, just like the unemployment website in the spring. The phone lines were jammed. Seniors waited in the cold and in the heat for hours only to be turned away. It's easy to say everybody gets a vaccine, but you actually need to do the work to make that occur. I don't criticize the governor for seniors first. Getting as many shots into the arms of seniors as possible is the right thing to do. We've got 4.5 million seniors and only 400,000 vaccines at the time. We don't need a plan that's a bumper sticker statement, especially if you're only going to give out half of them. No guidance, no coordination, no predictability, no way for people to plan. That's why we saw seniors waiting in long lines overnight, driving 2 hours only to be turned away many times. Seniors First is flinging the doors open for mass vaccinations, which could be great if we were only prepared. But the governor did not prepare. Why is it that Publix can tell you the closest place to get a vaccine and Tallahassee can't? Now FEMA is coming in to fill in the cracks where the governor had failed. 2, protect the most vulnerable. Yes, this is absolutely means seniors, of course, but it also means those seniors hit the very hardest. This means we should be focused on Black, Hispanic, Native American seniors, along with seniors across the board. We say the virus doesn't discriminate, but that's not what's happening in Florida. Look at the numbers I just discussed. Unfortunately, because of a lack of leadership from Tallahassee, important Floridians are being left out on their own to figure out the vaccines. Out of the 2.8 million people in Florida who have gotten the vaccine, only 180,000 have been Black and 286,000 have been Hispanic, despite making up, as I said earlier, 16% of our population and 25% of our state's population. The proof's in the pudding, my friends. If you're taking vaccines that would otherwise go to counties for the lines and putting them in wealthy, healthy, white, gated communities, you're not protecting the most vulnerable among us. This is too important to put politics and photo ops ahead of fighting this pandemic, period. If any senior gets to skip the line, it should be the people most likely to get very sick or killed from this virus. That's why you got to put pop-ups in South St. Pete, not in the gated suburbs. There's no Publix around here. There's seniors in this community who need to be protected. Let's go out of our way for people in need. It's important. Number 3, transparency. Florida has some of the country's best public transparency laws in the nation. Sunshine laws for Sunshine State. And yet the governor is keeping all Floridians in the dark about how these decisions are being made. People are concerned that the governor is using his vaccine power to reward political donors and supporters, and that is unconscionable. And when wealthy gated subdivisions get their own special pop-up, it's time to come clean. Right now, we've got more demand than supply. People are frustrated, and that's understandable. But if you're being transparent about your decision making instead of arbitrary or political, people will understand. Just be honest with them. Tell them the truth. Be straightforward. It is also about making the people you serve, your bosses, our bosses, know that they are not alone, that somebody cares about them, and you're going to disclose to them what your plan is before it begins, before the hurricane hits, before the vaccine gets here. That's not what's been happening, and it's a crying shame, and it breaks my heart. I love Florida, and I love her people, and what I'm seeing out of this current administration is truly heartbreaking, but I know we can do better, and I'm looking forward to hearing to Reverend Irby tell us about his observations. Reverend.
Good morning. I'm Reverend Kenny Irby. I'm the pastor of Historic Bethel African Methodist Episcopal Church, and just wanted to thank the Congressman for this opportunity to shine a light on the challenge that we're facing in Pinellas County in particular. I have the privilege of pastoring the oldest church in the city of St. Petersburg in one location, so that clearly says something about the demographic of our congregation. Even though we have an intergenerational congregation, we have a history and a proportionate number of seniors who have been trying desperately to get this vaccination. So I can stand here without fear of contradiction or equivocation to state that the black church, that in this community, the gathering of pastors, the Interdenominational Ministerial Alliance, and the Road to Calvary Group and others have joined together to build capacity and mobilization to bring people to the vaccine. We're saying, get the shot. Our challenge is not the demand. We have been able to demonstrate through partnerships with the Department of Health and the Emergency Management Center here in Pinellas County, and we have now brought to bear 6 to 8 pop-up sites, depending on how your county knows on the weekends, but there are only 500 doses. And so the volume that we need to do, we need to expand that. We've been focusing on the fact that this is a life-saving ministry and mission, that we have to be mindful that those who have been relegated to the margins, marginalized, the lost, the last, the least among us, need to have this shot and this inoculation and this opportunity. We're asking the governor to work with us. We have a model in St. Petersburg where the city, the police department, and the faith community, regardless of denomination, an ecumenical movement is at hand that we want to demonstrate that we can help with. There are 3 things that we have to also understand. There's a blessing in 3s for some of us who, somebody would say amen if I were in a normal situation here for preaching. But here's the reality. Trust is number 1. And the faith community has a history of mobilizing and providing a safe space for people to come and to get their needs met. And so we have been debunking this idea that black folk don't want the shot. There is a small proportion, yes, but the vast majority of individuals we've been able to bring to bear and to bring into the communities at the respective faith locations that we've been able to create opportunities. Number 2 is technology, and that is definitely an equity situation and disparity that we have to overcome. Everybody doesn't have broadband internet and access and time or the devices, and so we've created a hub network to overcome. Our larger churches and faith centers have cooperated and are partnering with smaller groups, and we're funneling folks through monitoring and messaging to build our list so that we can be efficient and effective on the day when we have the pop-up. And then thirdly, transportability. That is a huge challenge in the black community, the Hispanic community, the indigenous population. We know that this is not code language. This is the reality that America is facing that has brought us to this point where we have to stop politicizing lives in America and make a commitment to saving all of our people to the best of our ability. God bless you.
Now I'd like to call up two very brave young women, Wanda Williams and Anna Dotson, who live right here in St. Petersburg, to share a few words about their story. Ladies, please.
Good morning. Good morning. My name is Wanda Williams. I'm here from St. Petersburg, member of the Gibbs High Class of 1970. And I'm here to represent exactly what my shirt states. I am my ancestors' wildest dreams. Never in their history have they thought that we would be able to stand before Congress, a congressman, the news media, black pastors, to voice our opinion about what we feel is going right and what is going wrong. I'm very fortunate that I was able to have both doses of the vaccine, and me being a veteran, I was registered to the VA website, and their priority was to give the doses to the World War II veterans in order, descending order. So therefore, I was on a waiting list, waiting for my turn for the Vietnam veterans to get here. But fortunately, with the help of Reverend Irby and the black churches getting involved, I was given contact with a black church that was scheduling vaccine appointments. And that is how I got my first dose of the vaccine. And what was so great about that is that at the time that I had my first dose, they gave you an appointment card with the appointment date and time for your next dose. So you didn't have to worry about trying to schedule a second dose. It was already done for you. You kept the same appointment time and came to the same place, and you didn't have to wait in line. And it was smooth sailing and everything. So I'm very fortunate to have had both doses. I have not had any side effects. The second shot, my arm was a little sore, but that's to be expected, I imagine. But I did not have any headaches, fever, anything, any ill effects. Very helpful and very grateful. I still wear my mask. I've had both doses, but I still wear my mask because I want to protect me and others around me. I do not feel like I'm Superwoman because I've had both doses. Still, be vulnerable to your surroundings and do your social distancing. Anna, my friend and my neighbor for years and years and years, is here, and she had a more difficult time than I did. That's why she's here. Come on, Anna.
Hi, I'm Anna Dotson. I'm an imported Floridian, 35 years up north, and I just mastered 36 years here in Florida. My story is odd because I'm the one who knows about computers and how they work, yet I couldn't track down how to get my vaccine. Wanda sent me a text that her church was doing the vaccines, gave me the number. I called it. They sent me to a text message because the voicemail was overloaded. They even called me later to see why I had canceled, which of course I had not. It was just that they had a few left over and were accepting walk-ins, but I lived too far away, so that canceled that. But through her organizations, I learned how to sign up and get online so that I at least had a contact point. I tried calling Pinellas County when they were in the phone system. It crashed both times I tried to call. Then we went with Publix. You'd sit there for an hour to an hour and a half, depending on how many doses they had available or how fast they registered people. And it showed counties from all over Florida. Volusia and Palm Beach, of course, had the largest number of doses going in their direction, which I thought was a little odd because their population doesn't seem to be that high. I'm 71. My husband is 62 and a heart attack survivor twice over. My daughter is 50. She teaches school. She had to learn how to find the mask where she could talk through the mask, not only to the students in the classroom, but the ones that were also on her computer. This is a very complicated time. I haven't been able to hug my daughter in a very long time. My husband has not missed a day of work through this. He's been out there taking care of business. We share a house together, so he's very careful when he's out in public so that he doesn't bring it home to me. I finally got a text from the CDR that said if I would get on the website right now, and this was 8:45 on a Friday night, and my body was going, don't look at that phone, don't pick it up, but I did. It said to get on your computer now. It walked me through how to register it, and within 3 days I was up for a vaccine. All of this started on January the 13th when Wanda called me and texted me. And finally, I got my first vaccination, and on the 16th I will get my second vaccination. So please, anybody and everybody that's able to get there, do it. This is just a crazy time. I miss my family. I miss my friends. I haven't even been able to hug Wanda, who, by the way, is not only a vet, but she's a cancer survivor. So peace to all of you. Let's just keep going forward.
Thank you very much, ladies. I appreciate that. It's very encouraging to hear your personal stories and your courage in getting this vaccine. I'm really proud to introduce my dear friend, Reverend Watson Leon Haynes. As I mentioned, we went to high school together. I was honored and privileged to be in his wedding. And with no more, I'd like to turn it over to this great man and leader of our community, also president of the Pinellas County Urban League, Reverend Watson Haynes.
Thank you, Congressman. I'm not an exception to what you heard today. I wish I could say that I was. I wish I could say that I got on the phone, called, got an appointment immediately, and it happened. Well, it didn't. I have 3 computers in my home, about 30 computers at my office. I have a cell phone. My grandchildren have phones. I tried 8 times. My wife tried 9 times to get an appointment. You know, we had to, number one, sell ourselves on the fact that this thing was dangerous, that it was killing people. And we were not willing to die if there was a cure. And so when the advertisement came on about calling and setting up an appointment, every time I got on one time and got all the way to make the first appointment, and it kicked me out because I could not make the second appointment. We kept trying. And it's thanks to Reverend Irby and the pastors in the African American community that somebody heard our cry. And we said that we wanted the vaccine. And here I was, the Urban League CEO, begging people to get the vaccine, and I couldn't get it. And so one member of his congregation called and said, we understand that you need the vaccine. Well, at 3 o'clock today, the numbers will go down, and there's a possibility that if you and your wife would show up, they can get the vaccine. And so sure enough, we showed up. We got the vaccine a few weeks ago, and today, this afternoon after 2 p.m., we will have that second shot. But that's ridiculous. That's ridiculous. That people are dying. This is not some little crisis where you're going to catch a cold. People are dying, and there is a cure. But the cure can't get to them. That's why the county commission some years ago provided this van to the Urban League so that we can go into communities throughout all of Pinellas County and do prevention, to do intervention activities. But let me tell you, this is unlike when Dr. Crist, Charlie's father, was alive. Charlie's father was criticized because he allowed African Americans to come in the front door of his medical practice to get services. Well, what we have now is we have African Americans right now sitting at the back door, waiting to be allowed to come in the back door, not in the front door. We have a situation in our community where there is a severe laceration when it comes to the black community. We cannot put a bandage on a laceration. It needs stitches and long-term care. If we don't increase the number of folk being vaccinated, more people will die. That is not a joke. That is not something I'm thinking about. That is happening every day as I open the newspaper and see people who I know who were healthy, who died because of the lack of a vaccine. So this is critical to us. This is critical to the black community. We are willing to go, as these pastors have done, church to church. But you know, 500 shots on a Saturday, we got to go a lot of Saturdays. So we've got to create ways to be creative and get to African Americans who are in need of a vaccine. I thank you all for carrying the message. It's very clear we want to stop people from dying because of our inability to meet their needs for a vaccine.
Once again, I want to thank these people for being here today. Reverend, Pastor, ladies, appreciate your presence. If you all have any questions, we'll do our best to answer them. Yes, ma'am.
I'm from ABC7 in Sarasota, so we are abreast of everything that's going on there. What do you think to do? One thing that we notice a lot is that when we go to assassinations, like there are very few Black people in line, if at all. What do you think the plan needs to be able to help this, especially in a community like Sarasota?
Well, what these gentlemen just talked about, bring the vaccine to the community. Bring it into the neighborhoods, the Hispanic neighborhoods, the Black neighborhoods. Have the governor do a pop-up here in South St. Petersburg. I mean, that would be wonderful. You have to bring it to the people. And right now, he's bringing it to the wealthy and the donor base. And that's just wrong. That can't continue. It is outrageous. It is unkind. It really is. I wear these yellow bracelets on my hand every day. And they say, practice the golden rule every day. You know the rule. Do unto others as you would have done unto you. It's out of the Bible. We need to have that out of this administration.
Outside of
Yeah.
What the governor can do, is there anything that can be done, talking to county leaders, what you can do with your office, have something in place to get the vaccine into these communities when it's finally ready to do it?
I think you heard Reverend Irby talk about it straight up. Just brought it into the people. That's the way Watson was able to get the vaccine. We just have to have more access, more fairness, more equity. You shouldn't have to lecture people about this. I was raised to do that, to treat everybody with decency and with dignity and with fairness. We're all children of God. And when you realize that and you understand it and you live it, then you don't pick certain areas to get the vaccine and others to be left behind. As Watson said, we're waiting at the back door. We're having to wait at the back door, African Americans, Hispanics, in order to just get in to get the vaccine. There's nothing right about that. It is dead wrong, and it needs a change. The governor can help do it. President Biden is helping do it. The pastors are doing it in the community. We need to have more people do it. We're all children of God. We need to help each other every day. Yeah, of course.
I have the privilege of being a part of the Pinellas County Work Group. And so I can say that in this county, we definitely have the organizational capacity, but we have to be clear about this and speak truth to power. It's also about resources, right? It's not only about having the doses, you have to have the nurses to actually distribute the inoculations. You have to have the locations. As Reverend Haynes alluded to, the Saturday pop-ups we're only scratching the surface. We have to have a plan. The Word of God, the sacred text tells us that where there's no vision, the people perish. And that's exactly what we're having here, because we don't have visionary leadership about how and who needs to be able to receive this vaccination and how consistently we can be able to bring it to bear.
Any others? Yes, ma'am.
What are you hoping that the DOJ does do in regards to the governor and Commissioner Crist?
Well, I hope they do exactly what the Sarasota County Sheriff's Office is doing. Investigate what's happening with this distribution, or should I say lack of distribution of the vaccine. I mean, it's just wrong. And, I used to be Attorney General, and I understand law and order, and I understand the rule of law. And what we need to have happen here is a thorough, comprehensive, independent investigation of how the governor is distributing this vaccine in the state of Florida. This cannot stand. The lack of equality, the lack of equity, the lack of fundamental fairness is what Florida is suffering from right now. We're averaging close to 200 people dying every day. As Reverend Haynes said, this isn't a joke. People are dying. It's not funny. And so that's what I'm hoping for from the Department of Justice, and I'm glad that the Sarasota County Sheriff's Office is already investigating. It's very important and very encouraging, frankly. Sheriff Wells is doing a good job. I knew his dad, Charlie Wells.
I have just one more question, if that's okay. If it seems like the governor is not actually listening, to what you guys are saying and what the pastor would say, how do you think these changes could actually happen?
Well, let's hope he starts to listen. You know, Watson said my dad's a doctor here in St. Pete, 55 years, a family doctor. And he always used to tell my three sisters and me, God gave you 2 ears and 1 mouth. Listen twice as much as you talk, and it's amazing how much you can learn. I hope the governor is listening. It's important to Florida. Yes, sir. Reverend Irby.
Could you give us more information on these Saturday pop-up locations, where they are, that 500 shots, kind of explain all
Well, the Saturday pop-up vaccination sites, this Saturday we're moving towards Bethel Metropolitan, which is on 34th and 26th, the intersection there. They have 500 vaccinations that have been allocated to them. And then also on this Saturday, we have the second dosages that are at 20th Street Church of God and First Baptist Institutional. Each of those sites have 500. And then we're actually working, because this is a long county, north of Almaton, we have outreach that's going on as well. But here in the city, those are the 2 locations that are currently scheduled. And we have 9 other locations that we've already conducted site visits and have congregations that are prepared. That's why I'd say the demand is in place and a process, but the supply we have to wait. And now with the 3rd vaccination coming online, Johnson & Johnson, we hope that that will give us some energy and injection in terms of scale.
And in terms of the 500 shots they last week, were all the 500 used? And where did you get those shots? Did you get from Hamilton County?
They're from the health department. Our group, the work group, is conducted by Dr. Cho in the health department.
And were all 500 shots used last month?
Oh, yes. Absolutely. We have wait lists in each of those sites, and we are partnering with the Foundation for Healthy St. Pete and the Health Department, and from our database, we are moving folks, as Reverend Haynes alluded to. At the end, we normally have dosages vary from 15 to 20 dosages that are available, and then we go to that first responder list to bring those folks in. But in each instance, we've had from 150 to 200 representatives that we've had to put on a wait list until we hear from the county when we will have a next location.
Any others? Well, thank you all for being here. Appreciate you. All glory to God. Amen.